Intro. Welcome to our channel. Today we will talk about Ozempic, the most searched medicine of 2025. What is Ozempic? Ozempic contains a drug called semaglutide. It was originally made for patients with type 2 diabetes, but now it is also famous for weight loss. How does it work? Ozempic works like a natural hormone called GLP-1. It helps the body release more insulin. It slows digestion and keeps you full for longer. This is why blood sugar improves and weight goes down. Usage and dosage. Ozempic comes as a pre-filled injection pen. It is injected under the skin of the stomach, thigh, or arm. Most doctors start with 0.25 milligrams once weekly. After a few weeks, it may increase to 0.5 milligrams or 1 milligram weekly. Some patients may use 2 milligrams if needed. Never change the dose without your doctor. Price. In the United States, it can cost $800 to $1,000 per month. In Pakistan or India, the price may be 20,000 to 40,000 rupees per month. Always check with your local pharmacy. Side effects. Common side effects include nausea, vomiting, and stomach pain. Some people may have diarrhea or constipation. Serious but rare side effects include pancreatitis or kidney problems. If you feel severe pain, contact your doctor immediately. Precautions. Ozempic is not for everyone. It should not be used in type 1 diabetes. Not safe for pregnant or breastfeeding women. Avoid if you have thyroid cancer history. Always use Ozempic only with a doctor's advice. Conclusion. In summary, Ozempic is helpful for diabetes and weight loss, but it is not a magic solution. Healthy diet and exercise are still very important. Never use Ozempic without medical supervision. If you found this video useful, don't forget to like and subscribe.